So this also concludes the day of discussions that we had with 6 different panel sessions, looking at the different aspects of the skills crunch in the health sector. So let me share some of the recommendation, or, some of the topics that we discussed in an arbitrary order. They're not at all in the order of the panel session, but I've heard recommendation that we need to massively upskill the patients and the healthcare professional if we want to move to a person-centered, value-based health. And this is a major cultural shift for the sector. We should look at marketing and marketing the jobs, marketing the sector in a way that clicks with a diverse set of talent, whether the young population or people who would not think of health as a profession but have the skills. And on the other hand, I've heard some panelists saying that the health sector really needs to learn how to incorporate such a diversity of skill sets, because there are many of the sessions talked about multidisciplinary, interdisciplinary collaboration and so on, but the sector seems to have some work ahead in terms of incorporating those skill sets and attracting especially those skill sets. So there's a lot about communicating the value, the sense, the signification, the impact of the work and the sector to attract more talent. And I think it has been mentioned by different panelists, we have a momentum here. The COVID pandemic may have changed the way that the public sees the health sector, and we should leverage this to increase the attractivity. We've heard, I think that was in the first panel session, that the sector needs it needs more backgrounds, it needs more diversity, and it is essential for the company to grow, and it may be more essential than attracting funding. We've also heard, and I think this is something that will speak to the EIT Health consortium and the mission of EIT Health. We've heard that the training should start from what the industry needs and what the sector really needs on the fields, and the training programs should be designed to answer those real needs, to ensure that the skills match the expectations of the labor market. I've heard also quite a lot of talks around partnerships, either public-private partnerships to deliver action and to increase impact. We've also heard about cross-industry collaboration and how several industries can come together to try and tackle the talent crunch. There's one recommendation that speaks, it's about flexibility. So flexibility in the way talent should move between sectors. So, someone mentioned we used to have a lot of talent from the textile sector, and now we don't anymore. They just stay within the health sector, and we sort of miss on attracting those talent from outside of the health sector. But also flexibility in the way of lifelong learning, because you need to adapt your knowledge, you need to adapt your skills as you go along. And so the training offer should also be more flexible and be more adaptive, quicker to incorporate those new knowledge. I've heard, and let me maybe conclude on this recommendation, that we have a huge chance now. There's both a huge need, but we have a huge chance to open up the sector now. We need to accept in diverse sets of skill sets and profiles if we want the health sector in Europe to continue to innovate and bring innovation to the patient. So those are some of the recommendations that we've heard, some of the topics that were discussed throughout the 6 sessions, and I want to really thank again the panelists. I want to thank the audience for listening in, for interacting, for asking questions. This was the launch event of the WorkInHealth Foundation. The WorkInHealth Foundation is set up by EIT Health, and it's looking at attracting, recruiting, training, and retaining talent. And the foundation is now actively looking for corporate donations. So if you think your organization would like to partner or you would like to support financially the foundation, you can give us a call. There will be a little pop-up window on your screen with my contact details that you can look at. And stay tuned. There will be more events, more discussions, more thought leaderships, more reports and publication as part of the work of the foundation, and more connections between talent and employers. So a huge thank you again to the audience, to the panelists, to the organizing team. Thank you and goodbye.